Hello, this is Judith Bendersky and Sarah Clark, and she'll introduce herself in a moment. And we are bringing to you the CMS Medicare Supplement Insurance, also known as Medigap, Policies webinar. This is based on Module 3 of the CMS training materials for 2018. Thank you so much for joining us. Again, my name's Judith, and I'm the field supervisor. You should be able to see on your screen my telephone number and my email address. And Sarah, would you like to introduce yourself?
Yeah, my name is Sarah Clark, and I'm the new regional training consultant for King County, Snohomish, Whatcom, Skagit, and Island counties. Soon I'll be up in the Seattle office, so maybe I'll get to meet some of you who are watching this broadcast.
Yeah, and at that point, you'll have a phone number that you can put in there. Thank you very much. So what we're going to do is we're going to present the Medicare Supplement Insurance, and let's get a larger screen for you. Here we go. I'll just click on this button. Thank you for your patience. So the content of this webinar includes an introduction to the vocabulary of Medigap, a little bit about standardized Medigap plans, things that you can tell your clients about buying a Medigap policy, very important rights and protections that Medicare beneficiaries have regarding Medigaps, including Washington-specific rights, guaranteed rights, and other rights to try out a Medigap or swap back to a Medicare Advantage plan. And throughout, Sarah is going to have some questions that may represent some questions that you have in your mind. And we'll also have some scenarios that you'll have the opportunity to think about. Again, we're going to explain what Medigap policies are, recognize key terms, talk about buying, the best time to buy, and explain guaranteed issue rights. So, as you know, when people originally sign up for Medicare, there are two main ways for them to get Medicare, or to get a supplement to Medicare, and that includes a Medicare Advantage plan or a Medigap. Original Medicare, of course, includes Part A and Part B, and many people have set in their mind that they're going to get a specific Medigap policy from a specific company, or they're going to get a Medicare Advantage plan, especially if they live in a county where it's very difficult to find physicians and healthcare providers that take Medigap, and all of the providers are participating in or in network with a very specific Medicare Advantage plan. There's nothing wrong with that. So this slide shows original Medicare adding Part D and Medigap versus adding a Medicare Advantage plan, also known as Part C, which includes Part D coverage. A Medigap policy is a private health insurance plan that is designed to supplement original Medicare. So after Medicare Part A and B pay 80% of the Medicare allowed amount, claims cross over automatically to the person's Medicare supplement for handling the remainder, which is typically the 20%, also known as the coinsurance. The Medigap policy pays its share. A person must have Medicare Part A and B in order to buy a Medigap policy. I liken this to thinking about how people may want to buy shoelaces, but you have to have shoes for it to make sense for you to have shoelaces, which then supplement the shoes. So call it a silly example, but you have to have both parts of Medicare in order to qualify to pay for the supplement that supplements both parts of Medigap. Medigap policies cover only one person. So a person will buy a Medigap policy for themselves, and the spouse may purchase the same Medigap policy or a different one. Regardless, a person still pays the monthly premium for Medicare Part B. Medicare supplements are different from Medigap policies are different from Medicare Advantage plans. So this slide gives you sort of a side-by-side comparison of who offers them, who oversees them or regulates them, what they cover, what you must have, and if you have to pay a premium. So both Medigap's and Medicare Advantage plans are covered by private companies. In terms of who oversees them, the state of Washington oversees and regulates and approves rates for Medigaps, but the federal government oversees and approves rates and contracts for Medicare Advantage plans. Gaps in Medicare supplements, also known as Medigap, gaps include help paying deductibles, coinsurance, and copayments. Whereas a Medicare Advantage plan covers all of the services that a person has the right to under Medicare Part A and B, and also may cover other things like vision or dental coverage. And most MA plans cover prescription drug coverage. So Part D, as in drugs, is part of Part C. Now, there are a few MA plans in Washington that are not inclusive of prescription drug coverage, but most are, and we call those sometimes MAPD, meaning Medicare Advantage and prescription drugs. Both for Medigap and Medicare Advantage, a person has to have Medicare Part A and B, and there are premiums each month for a Medigap policy. In the Medicare Advantage plan world, not all plans have a monthly premium. Some of them have a zero premium. Okay, so let's talk a little bit about costs. As our Medicare Part A and B cost comparison QRC shows, there's a deductible for Medicare Part A, as in Apple. There are inpatient, hospital stay, co-insurance pay charges, skilled nursing facility charges after the 20th day in a skilled nursing facility, and there's a 5% hospice charge for most prescriptions. So those are some of the costs in original Medicare, and for Part B, $183 a month for the deductible, and that's the figure that may go up. It may go up in 2019, we don't yet know, and the coinsurance of 20%. So it's a fair generalization to make that Medicare Part B pays 80% of most covered services. Most. And so that's the value of getting a Medicare supplement, is that it helps pay that 20%. And the monthly Part B premium is $134. So let's do a little bit of a check-in, an assessment. If you join an MA plan, you can buy a Medigap policy to pay for out-of-pocket costs. Is that true, or is that false? Well, it's kind of a trick question because we haven't addressed it yet, but that is false. It's really wise to use the pathway and explain to your Sheba clients that you choose one or the other because they're both intended to supplement Medicare. A Medigap policy will cover you and your spouse. Is that true or false? Sarah, any guesses?
My guess is false.
You are correct. It is false. All right, let's talk about Medigap standardized plans. So you may be used to seeing a very busy grid that looks like this, and we're going to break it down a little bit. There are 10 standardized plans identified by a letter, except for 3 states, Massachusetts, Minnesota, and Wisconsin. They had Medicare supplement policies and legislation around them before standardization of Medicare supplements came to be. But we're in Washington, and so we have 10 or so lettered plans, A through N, but plans that no longer exist, even though some people have them that have been grandfathered in. We don't see companies selling plans E, H, I, or J anymore. They're selling these. And we have a really nice listing of those that you can get on our website and that you're probably quite familiar with. So generally speaking, looking at the busy grid, Medicare Plans A, Medicare Supplement Plan A offers the fewest benefits. They cover the basic benefits, including Part A coinsurance, Part B coinsurance, the first 3 pints of blood. I call that the 3-pint deductible. And Part A hospice coinsurance. So it offers the fewest things. It doesn't offer coverage for these boxes. They're blank. On the other side of the coin is Medicare supplement plans, F as in Frank, or as I used to say to people, F is the fullest, because it offers the fullest array of benefits. And then next comes Plan G. G offers everything that F offers, except it doesn't cover the deductible. There also is a high deductible plan, F as in Frank, and that makes sense for some people to purchase. And there are some plans that don't pay 100% of everything, of all these benefits. So some people may choose a plan M or a plan L, thinking that they're never going to need these services. They're going to have coverage only that will help them with 75% of the costs. So people are wise to think about what benefits they really are looking for or think they may need in the future, and then to select the letter that makes most sense. We don't have in Washington Medicare Select policies, and I believe that in 2020 or maybe in 2021 there won't be Medicare Select policies anywhere. So each standardized Medigap plan A through M must offer the same basic benefits no matter which insurance company sells it. Is that true or false?
I don't know. What do you think?
I think it's true. I think that if you are shopping and you call around, let's say that you're interested in Plan C as in cat, and you call Assurus, and you call United Healthcare, and you call USAA, and you call Mutual of Omaha, and any other plans that the OIC approves, I think you will find that the benefits are the exact same thing across the board. The price may be different, but the benefits are the same. Okay, we're not going to worry too much about the waiver states. We're going to talk next about buying a Medigap policy and when is the best time to buy a Medigap policy. That's going to lead us right into some specifics about Washington. And Washington State has a wonderful reputation as being a guaranteed issued state, and that means certain wonderful benefits, and we'll talk about that. So this is a very interesting visual. Washington is a state where you can be under 65 on Medicare and not entitled to any Medicare supplement that you may want to select. So you're limited when you're under 65 to a couple of options. But everybody does pay a monthly premium, and that monthly premium may be impacted, for instance, in Washington, by age. It may be impacted by the company providing the plan, and it will be impacted. The prices are different. All of the Medicare supplements offered in Washington have the same price no matter where you live, so this is not going to be a big factor. Whether you're in your Medigap open enrollment period could impact your cost, and that is the first 6 months when you both have Part A and B. When you have both Part A and Part B, you trigger your 6 months of your open enrollment period for Medigap. That's a one-time ever in your life 6 months. It doesn't start again if you go back to work or if you cancel Part B and start later. You have one time ever in your entire life of 6 months open enrollment period for Medigap. If you are, let's say, 100 years old and decided for the first time that you want to get a Medicare supplement, and you're way outside of your Medigap open enrollment period, and you weren't working and there wasn't any other equivalent coverage, then you may find that you're medically underwritten, and you may pay a higher price, and this does not apply. We don't have, this Medicare Select is not applicable to us. So there are a variety of factors. So when people say, I'd like to buy a Medigap policy, can you tell me which one is the best cost? Your answer is not simple, and there are a number of factors. All right, next slide. And I'm going to just pause for a moment and let you have a look at this. So there are several types of ratings, and different states use these rating types differently. In Washington, everyone pays the same rate regardless of age if they're 65 or older. So we have a chart that I'll show you on my Sheba, and you will see that. However, it's very interesting to see these definitions of issue age-rated and attained age-rated. Now, that doesn't mean that the cost doesn't go up due to inflation, and in fact, that is a very real factor in Washington State. The best time to buy a Medigap policy is during your Medigap open enrollment period. And the benefit of buying during your open enrollment period is that the companies don't have the option to medically underwrite you or screen you. Sometimes we say a health screening, and that may be a series of questions on the Medicare supplement application. So when you're counseling, as you probably know, it's really important to tell people not only about Medicare Part A and B, but get the ball rolling and get the wheels spinning about the importance of looking for a Medicare supplement or Medicare Advantage and making those decisions, as well as prescription drug coverage, so that the full array is in the person's planning process. If a person delays enrolling in Medicare Part B because they're working or their spouse is actively working, then the Medigap open enrollment period is delayed until the person is enrolled in Part B. So let's say you have a person that is on Medicare Part A and B. They get a Medicare Part A and B card, but they refuse Part B because they're actively working or their spouse is actively working, and so they're delaying Part B for later on. And then let's say they or their spouse stops working for good, and they're 70 years old. They can then add Part B using the 2 forms that Social Security will need, and once they're eligible and they have a card that says they have Medicare Part A and B, then that effective date of Part B triggers their 6-month open enrollment period. All right, pre-existing conditions in Medigap. There can be a waiting period. So in other words, and sometimes we call it the look-back period, a person can enroll in a Medicare supplement, a Medigap, but if they've been treated in an ongoing way for, let's say, cardiovascular disease, or just before they became eligible for Medicare, they had a hip replacement and there's some follow-up physical therapy, it could be that the new policy will start on the first month that they have Medicare, but that the policy will not cover things that were evident during the look-back period. So in the state of Washington, people under 65, either with Medicare due to disability or ESRD, are typically going to find a lower price once they start their new entitlement to Medicare at age 65. It then goes from Medicare due to disability or ESRD to Medicare, what's called by Social Security Medicare for the aged. And so that's a new entitlement, and that kicks open a new open enrollment period for Medigap. As I mentioned, it's not easy, but we recommend that people first decide what benefits they want by looking on the left-hand side of the busy grid or any of the literature that they may receive from insurance companies that are marketing to them. Then they find out which insurance companies sell Medigap policies in Washington, and then they call those companies, asking them some questions, taking some notes, verifying for themselves how the customer service is, and then either completing an application on paper or doing it with an agent directly with that company over the phone. And typically, when I've assisted people to do that, I will conference the person, and then I will conference in an agent from, let's say, Premera or United Healthcare. The agent will verify that they're eligible for the Medicare supplement policy, record the entire conversation, read a script, ask people to answer many questions, yes or no. That whole recording then becomes a legal document, which serves the purpose of replacing a wet signature on a piece of paper. But typically then that will be followed up by a written document and the policy and a bill. So those are the steps. Now, step number 1 is particularly important for SHIBA volunteer advisors because people don't know at age 65 what skilled nursing facility coverage means or what kinds of home health care is or is not available through Medicare or Medicaid. They haven't necessarily done all their homework or comprehend this vast array of options. And also people are in denial at age 65 that they may ever live to be 95 and need long-term supports such as skilled nursing facility coverage. So you can help people by explaining that, Plan F, as in Frank, or Plan G or Plan C, some of the fuller policy options may really serve them well because, for instance, if they have a knee replacement or a hip replacement or any kind of heart issue, after that initial operation, they likely will be discharged to what we call in Washington a rehab facility. That's a skilled nursing facility. And Medicare will only pay 20 days for that. And then after that, the Medicare supplement helps them with thousands and thousands of dollars worth of care. So maybe that example is helpful in helping people see that nobody really knows what tomorrow holds and what our health needs will be. And so it's best with insurance to get the best and the most comprehensive coverage that they may possibly need. So what I'd like to do is show you two documents that are on MyShiba. Let's talk about when you can switch policies, because in Washington we have some benefits that other states don't have. So bear with me for a moment. We're going to go into MyShiba, and I do that by sometimes I just type in on the website MyShiba and I chuckle that the first one that comes up is typically Shiba Inu, but we're going to go to the Washington OIC MyShiba, and we're going to go into the Shiba Training Toolbox, and we're going to look for resource materials that are specific and unique to Washington. So I want to show you the Medicare, the Medigap switching document. And that's here. It's called Switching Medicare Supplements. If you have not seen this before, you can print it, or you can save it, or you can bookmark this off of MyShiba. Generally speaking, there are quite a lot of circumstances in which a person has a guaranteed issue right to switch a Medicare supplement. And they're numbered here. So if you're 65 or older and you're within your first 6 months, Sarah, what do we call that special period?
Your open enrollment period.
That's your open enrollment period. We have scenario 2, 3, 4. I'm just looking at all the different scenarios, and we can summarize them. So we have 12 different scenarios. Now, anyone in the state of Washington that's been a resident for, I forget exactly how long, I think it's 6 months, they're able to, oh yes, no, it's 2 months, 60 days of being a Washington state resident. Anybody can buy the Washington Healthcare Authority Blue Cross Blue Shield plan. That is a little different than our standard Medicare supplements, and that's administered through the Healthcare Authority. But all these other ones are specific to people 65 and older, and let's just say, for example, a person has a trial right if they joined an MA plan, but they actually want to go back to their Medicare supplement. So 2 of these scenarios, number 5 and 6, refer to the trial right for people who want to go back to Medigap. And in Washington, people have excellent guaranteed rights around that. Scenario number 2, if you're in a Medicare Advantage plan and the plan is leaving Medicare or doesn't renew, or it stops giving care in your area, or you move out of the service area, then you can buy almost any Medigap plan within 60 days. So we always try to tell people you have 2 months to do X, Y, and Z, rather than 63 days. Just two months makes it easy for people to remember. If a person has original Medicare and an employer group health plan, or a retiree plan, COBRA, or union coverage that pays after Medicare pays, and that plan is ending, then they can buy any Medigap, almost any Medigap plan. And again, they have 63, but call it 2 months to make that selection. Select plans don't relate to us. Then we've got the 2 trial right periods. If a person has a Medigap Plan A, as in Apple, they can buy any other Medigap Plan A at any time. And if a person has plans B through N, they can also switch at any time to any other company and at any time. So they can go from Plan B to Plan F or Plan C to Plan N at any time, as long as they've had coverage within the last 90 days, so they don't want to wait too terribly long to do that. So without belaboring all of the guarantees that Washington has, this document tells you about that. And then the other document that's really important about Medicare supplements is the list of Medicare supplements, which we can find on the OIC website, and I typically go to insurance.wa.gov, and I click on Medicare, and then I click on Medicare supplement plans. And I'm going to see if this link will take me there to the Medigap plans. And here's the chart, and we keep the most recent one updated on this website, April 2018. Today is June 18th, so I imagine before you know it, we'll have the new rates. And we do show here that the high deductible plan, F as in Frank, has a $2,240 deductible for 2018. All right, so back to the slides. We will look at the give you a bigger screen in just a moment. Okay, here we go. Thank you for your patience. So we took a quick look at the switching document that is pertinent to Washington. There are federal protections for people in all states to switch, but the Washington regulations are even stricter. That's why it's really important that if you're on vacation in Arizona and you're chatting with people, that you understand that the rules may be different in Arizona than they are elsewhere. All right, I think we'll skip through the knowledge check, some of the knowledge check questions. Let's do this one. Coverage for a pre-existing condition can only be excluded in a Medigap policy if the condition was treated or diagnosed within 6 months before the date of coverage starts under the Medigap policy.
That's true.
And that is true. All right, moving right along. So this little section is about guaranteed issued rights, and we've taken a good look at them already. Let's take a look again. So John is in a Medicare Advantage plan. He'll have a Medigap guarantee issue right if he joined when he was first eligible and was in the first year of Medicare and wants to change back to original Medicare. So he wants to exercise his trial right, and that is one of the scenarios in the switching Medigap chart. So there's a trial right period. or his plan leaves Medicare, or his plan stops giving care in his area, or he moves. So he's got a right there. Mary has original Medicare. She has a Medigap guarantee issue right if her employer group health plan or union or COBRA or other coverage pays and it's ending, and that's correct. And then another good thing about Medicare supplements is that they are guaranteed renewable. So this is a good thing, and to some degree, for some people, it can be a bad thing. So Medicare supplements are guaranteed renewable, meaning you don't have to call up each year and renew your Medicare supplement. It auto-renews without proactive behavior from the member. Now, that is sort of similar to Medicare Part D, as in drugs. And the only time that that's really bad is if there's been a rate increase and the person hasn't noticed, hasn't looked at their mail, and had they really known, maybe they would have done some shopping at the time, but year after year they don't pay any attention, and the credit card is being billed, or an electronic fund transfer is taking place, and they just really don't notice. So that's, but for most people it's really good, because no matter how sick or how much treatment a person has had, the Medicare supplement can't cancel them because they became a high risk or a high cost member. People have the right to suspend Medigap, and this can be very helpful. I think, Sarah, you wanted to ask a question about how that might work. Do you want to pose your question?
Yeah, so I have a client who I've been working with, and she's been in original Medicare for 10 years, and she has a Plan F, Medigap. She's been thinking about switching or trying out a Medicare Advantage plan in the next open enrollment period, and she wants to know if she can keep her Medigap policy at the same time as having a Medicare Advantage plan.
Okay. So that really does relate to suspending a Medigap. Let's talk that through. So your person, your client's been on Medicare Part A and B and has had a Medicare supplement covering their 20% copay. And does this person have a Part D plan to cover their prescriptions?
Yes.
Okay, so they have Part D. If they go to enroll in a Medicare Advantage plan, which they are welcome to do any year, that, you know, any time during annual open enrollment, October 15th through December 7th. When the Medicare Advantage plan goes to enroll them with a start date of January 1, it's going to trigger a termination of their Part D, as in drugs, because their prescription drug coverage will be henceforth covered under Medicare Part C, or the Advantage plan. And the Medicare Advantage plan may or may not send a letter to the client saying, hey, by the way, any other creditable prescription drug coverage that you may have had through Medicare, meaning Part D, is going to terminate. And they may or may not get a termination notice from the Part D plan. So while they are welcome to enroll in a Medicare Advantage plan and continue to pay for a Medicare supplement, I would recommend that they do one of two things. They either drop the Medicare supplement plan for the year, exercising their trial right to then get back in within 12 months and to purchase back the Medicare supplement plan that they had before they joined the Medicare Advantage plan, or that they call the Medicare supplement company and ask if they have the right to suspend their Medigap policy. My understanding is that a person can suspend their Medigap policy not just because they may have gotten into Medicaid and they want to see how that works, but because they want to for up to 2 years. So I've talked to people who are missionaries. They're going to be away on a mission for 2 years, and they're going to have coverage, or going on the Peace Corps, or they're going to spend a year and a half in Thailand, or Costa Rica or whatever, they can suspend their Medigap policy. Does that give you some good options for them to explore?
Yeah, I think that will help her out.
All right, great. During the time that a person suspends their Medigap policy, they don't pay the Medigap premium, so that's a good savings. But by the same token, the Medigap policy isn't going to pay on any benefits, which makes sense. You've suspended, it's like suspending or canceling your car insurance for a couple of months, but if you get in an accident during that time, you're not going to get any help from the policy because for that couple of months you weren't a member. So we'll learn more about suspending Medigap policies and share that later on. All right. So Medigap policies issued after what year are guaranteed renewable? We did kind of fly past that pretty fast, but let's see.
My guess is 1992.
I believe you're right. Let's look and see. Yeah. So starting in 1992, Medigap policies are guaranteed renewable. This is a good thing for almost all of our beneficiaries. So let's look at this scenario. Ted is 64. He's had Medicare for 4 years due to disability. He lives in a state that requires insurance companies to offer a Medigap policy to people who are under 65, which unfortunately at this time is not Washington. And he has a Medigap policy. So what might happen when he turns 65 next year with that Medigap policy? What rights might he have that are different? Well, some things to consider is that he now, starting at age 65, will have an open enrollment period. He'll have a much broader choice of Medigap policies that are available to him at age 65, and he'll probably have a lower premium. Nobody can refuse to sell him a policy if he uses his first 6 months or that open enrollment period, and he will avoid pre-existing condition waiting periods since he had coverage for more than 6 months before he turned 65. So that's good. Let's review the key points. A person must have both Medicare Part A and B to get a Medigap. A person pays the Medigap policy premium plus the Medicare Part B premium. It's not included here, and that can be confusing for some people who may only know about Medicare Advantage plans. Medigap policies cover one person. Benefits are standardized in Washington with letters A through N, but E and I and J have gone away. The costs vary by plan and by company. Medigap policies cover costs associated with services covered by original Medicare. So I'm going to ask Sarah a question. So let's say that I have a client, and I have a client who really loves acupuncture once a month and utilizes the service of a holistic naturopathic doctor who is not an MD. And she says to me, well, if I buy a Medigap, will that pay for my acupuncture?
In general, no, because a Medigap will only cover 20% of Medicare-approved costs.
That's right. So, that is the right answer. Medicare is going to cover 80% of your allowed amount for your services and supports and supplies and lab work and so forth. And then only after Medicare has processed the claim will it go to your secondary or your supplement. So if Medicare doesn't pay for naturopathy or acupuncture, neither is your Medicare supplement. And that can be confusing.
Well, Judith, I have another question for you.
Okay.
So I have a client who has been on a Medicare Advantage plan for 5 years, But she's been having some trouble paying her costs. You know, the monthly premium keeps increasing. And an insurance agent talked to her and told her that she needs more coverage. And so he suggested that she buy a plan from him, like a Medicare supplement plan. And she's a little bit confused because she's been getting bills and saying that they're not going to cover these costs. Can you tell her what she should do?
Okay, so this person had Medigap and then bought a Medicare Advantage plan, and she's paying the monthly premium for both. Well, you know, it is unfortunate that a Medicare, first of all, I would want to know who the agent is, because probably was not the best advice. We don't want to see people overpaying or you know, being overinsured and not getting a benefit. When a person has a Medicare Advantage plan, that's going to become secondary, and then the Medigap policy is going to be tertiary, and it isn't going to pay on anything. So unfortunately, that person's been paying a Medigap premium and not getting any benefit out of it, and also possibly had a change in prescription coverage and wasn't aware of it. So I would recommend to that person that they speak to Sheba again and make sure they know the facts, maybe utilize the services of a different agent, and move forward with either the Medigap policy or the Medicare Advantage plan, realizing that if they cancel the Medicare Advantage plan, they may be without prescription coverage, although they should be in a special enrollment period to pick up Medicare Part D, because they will have canceled their MAPD plan. So they would want to not wait more than, they would want to get the ball rolling right away. So good question. Any other questions?
Not from me.
All right. Well, thank you so much for participating in this webinar. There are resources, as you know, the shiptacenter.org, shipta.org, medicare.gov, MySheba, and feel free to call Sarah or I. See if I can bring that slide up one more time with our faces. Maybe I'm not going to do that. So. But do feel free to call or email us with any questions. And this is the end of the webinar brought to you by the Washington Sheba program. Thank you. Bye-bye.